of Health is growing increasingly concerned about the rising rate of COVID-19 infections within the communities. The growing number of positive results from samples shows the positivity rate is rising by the day. In the last 24 hours, 375 people tested positive for the virus from a sample of 2,052, taking the total caseload to 16,643. The death toll rose by 4 to 278. Health officials asking persons with underlying conditions to take extra precautions to keep the virus at bay. Here now is Gov't with the details.
Health officials have noted a steady increase in the positivity rate from samples tested daily for the novel coronavirus. Out of the 2,052 samples tested today, 375 turned positive. It is not just the rising numbers that are an issue. The bigger concern has become the greater numbers of positive results from smaller samples. Today's figures showing that the infection rate stands at 18.2%, which means in every 100 people tested, 18 turned out positive.
And what should be worrying us more actually is the rate at which the samples we are taking are turning positive. That is what is more worrying to us, not the increased number of cases that are dying. As
the contagion permeates the population, more fatalities have been recorded. 4 patients succumbed to the disease, taking the total tally to 278 since the outbreak of the pandemic.
The positivity rate is going higher, so that for every 100 patients that you sample, 29 are turning positive in Nairobi, because that is what the figures we have today. That is the more worrying figure.
Of the deaths recorded, patients with underlying conditions are the highest. Case in point, when the number of mortalities stood at 250, 129 or 51.6% had what health officials call comorbid or underlying conditions. 14 people, who account for 5.6%, had no comorbid conditions. An additional 107 or 42.8% had missing data. A further breakdown of the figures of the COVID-19 deaths with underlying conditions recorded showed that patients with hypertension and diabetes account for 32%, hypertension alone with 17%, as diabetes posted 15%. Chronic lung diseases and cancer, each with 10% of the deaths. HIV and AIDS, on the other hand, as an underlying condition, accounts for 4% of COVID-19 mortalities.
Non-communicable diseases like diabetes, hypertension, renal disease, and many others take a toll on one's immune response and the ability of one's body to be able to mount a strong immune response.
128 people recovered today, raising the number of recoveries to 7,574, while active cases of COVID-19 now stand at 9,069. Health authorities are now prevailing on persons with underlying conditions, particularly hypertension and diabetes, to strictly stay at home unless it's absolutely necessary, to which they are required to wear a mask and social distance to keep safe. Gov't, Citizen TV, Nairobi.